Question 1, characterized by muscular pain caused by ischemia, or lack of blood flow to the muscle. A. Health belief model. B. Cerebral palsy. C. Peripheral vascular disease. D. Peripheral vascular occlusive disease. Question 1 Answer, D. Peripheral vascular occlusive disease. Question 2, at or above VT2. 10 to 20% of training time. A. Cardiorespiratory training zone 2. B. Cardiorespiratory training zone 3. C. Family history CVD risk factor. D. Respiratory exchange ratio. Question 2 Answer, B. Cardiorespiratory training zone 3. Question 3, the belief in one's own capabilities to successfully engage in physical activity program. A. Endumism. B. Reflecting. C. Hypertonicity. D. Self-efficacy. Question 3 Answer, D. Self-efficacy. Question 4, at or below VT1. 70 to 80% of training time. A. Benefits of resistance training. B. Cardiorespiratory training zone 1. C. Peripheral artery disease. D. Risk stratification. Question 4 Answer, B. Cardiorespiratory training zone 1. Question 5, set up self-monitoring system. Providing feedback. Effective modeling. Behavior contracts. A. Stages of client-trainer relationship. B. Client-trainer relationship, action stage. C. Client-trainer relationship, investigation stage. D. Stages of change, action. Question 5 Answer, B. Client-trainer relationship, action stage. Question 6, the quantity of blood pumped per heartbeat. A. SOAP note. B. Stroke volume. C. Baromeson. D. SMART goals. Question 6 Answer, B. Stroke volume. Question 7, caused by atherosclerotic lesions in one or more peripheral arterial and/or venous blood vessels. A. Peripheral artery disease. B. Peripheral vascular disease. C. Rheumatic diseases. D. Peripheral activity occlusion disease. Question 7 Answer, B. Peripheral vascular disease. Question 8, the percentage of the end diastolic volume that is injected with each contraction of the heart. A. Deliberators. B. Extinction. C. Ejection fraction. D. Acceleration. Question 8 Answer, C. Ejection fraction. Question 9, perceived seriousness, the feeling of contracting or leaving a threat undertreated. Perceived susceptibility, the likelihood of developing the problem. Cues to action that motivate people to make a charge. A. Health belief model, a degree of perceived threat. B. Cigarette smoker CVD risk factor. C. Health history form. D. Peripheral vascular occlusive disease. Question 9 Answer, A. Health belief model, a degree of perceived threat. Question 10, men, greater than or equal to 45 years of age. Women, greater than or equal to 55 years of age. A. Prediabetes CVD risk factor. B. Hypertension CVD risk factor. C. Age CVD risk factor. D. Obesity CVD risk factor. Question 10 Answer, C. Age CVD risk factor. Question 11, when a positive behavior is removed, the likelihood of the behavior will decrease. A. Inertia. B. Questioning. C. Extinction. D. Glucagon. Question 11 Answer, C. Extinction. Question 12, low sociability, high dominance. Cognitive, less effective, action-oriented, take charge. A. Inertia. B. Prices. C. Carcinomas. D. Directors. Question 12. Answer D. Directors. Question 13. Non-progressive lesion of the brain occurring before, at, or soon after birth that interferes with normal brain development. 2 types. Spastic increased muscle tone in flexor muscles of upper extremities. Athetoid involuntary, uncontrollable movement in extremities. A. Deliberators. B. Expressors. C. Cerebral palsy. D. Reflecting. Question 13. Answer C. Cerebral palsy. Question 14. Specific. Measurable. Attainable. Relevant. Time-bound. A. SMART goals. B. Sarcomers. C. Directors. D. Expressors. Question 14. Answer A. SMART goals. Question 15. Rapport continues to grow. Gathering info on client. Demonstrate effective listening. A. Extrinsic motivation. B. Client-trainer relationship, investigation stage. C. Integrated fitness training, IFT, model. D. Peripheral activity occlusion disease. Question 15. Answer B. Client-trainer relationship, investigation stage. Question 16. Have been doing regular physical activity for less than 6 months. A. Ejection fraction. B. Obesity CVD risk factor. C. Stages of change, action. D. Stages of nudge, maintenance. Question 16. Answer C. Stages of change, action. Question 17, aka anaerobic endurance training. Between VT1 and VT2. Building up endurance within this intensity. A. IFT FM and RT phase 1. B. Carcinomas. C. SMART goals. D. IFT cord phase 3. Question 17. Answer D. IFT cord phase 3. Question 18. Less than or equal to 149th millimeter of mercury on 2 accounts. On antihypertensive medication. A. Cigarette smoker CVD risk factor. B. Family history CVD risk factor. C. Hypertension CVD risk factor. D. Dyslipidemia CVD risk factor. Question 18. Answer C. Hypertension CVD risk factor. Question 19. Strengthening of muscles, ligaments, tendons, bone mineral density. Physical capacity. Physical appearance, body composition and body fat. Metabolic function. Injury and disease prevention. A. Benefits of resistance training. B. Obesity CVD risk factor. C. Positive reinforcement. D. Principles of training. Question 19. Answer A. Benefits of resistance training. Question 20. Decreased likelihood of behavior by introducing aversive stimulus. This is after an undesirable behavior. A. Antecedent. B. Punishment. C. Prices. D. Parmesan. Question 20. Answer B. Punishment. Question 21. Having extreme muscular tension. A. Prices. B. Inertia. C. Parmesan. D. Hypertonicity. Question 21. Answer D. Hypertonicity. Question 22. Open-ended questions that encourage the client to share relevant information. A. Summarizing. B. Reflecting. C. Encouraging. D. Questioning. Question 22. Answer D. Questioning. Question 23. Client may need help becoming more active. Ask probing questions. Listen effectively. Provide educational information. Keep the conversation friendly. Build self-confidence. Encourage clients to generate ideas. A. Positive reinforcement. B. Principles of training. C. Motivational interviewing. D. Operant conditioning. Question 23. Answer: C. Motivational interviewing. Question 24. Setting the scene for understanding and trust. First impressions. Verbal and non-verbal communication. Personality styles. A. Stages of client-trainer relationship. B. Extrinsic motivation. C. Peripheral vascular disease. D. Client-trainer relationship, rapport stage. Question 24. Answer: D. Client-trainer relationship, rapport stage. Question 25. At appropriate times, the trainer should summarize key points. Allow clients to comment on accuracy. A. Shaping. B. Questioning. C. Encouraging. D. Summarizing. Question 25. Answer: D. Summarizing. Question 26. Two components. Functional movement and resistance training. Cardiorespiratory health, NGT, fitness, NGT performance continuum. A. Predicted maximum formula. B. Cardiorespiratory training zone 2. C. Integrated fitness training, IFT, model. D. Health belief model. Question 26. Answer: C. Integrated fitness training, IFT, model. Question 27. The maximum rate of oxygen consumption as measured during incremental exercise. aka peak, maximal oxygen consumption, uptake, maximal aerobic capacity. A. VO2 max. B. Momentum. C. Carcinomas. D. Glucagon. Question 27. Answer: A. VO2 max. Question 28. Carbon dioxide produced divided by oxygen consumed. A. Respiratory exchange ratio. B. Extrinsic motivation. C. Stages of change, action. D. Risk stratification. Question 28. Answer: A. Respiratory exchange ratio. Question 29. Tell them relapse common and expected. Social support. Assertiveness. Self-regulation. Avoid high-risk situations. A. Stages of client-trainer relationship. B. Sedentary lifestyle CVD risk factor. C. Client motivational strategies, relapse prevention. D. Client-trainer relationship, action stage. Question 29. Answer: C. Client motivational strategies, relapse prevention. Question 30. 1. Stages of change. 2. Processes of change. 3. Self-efficacy. 4. Decisional balance. A. Client-trainer relationship, action stage. B. 4 components of transcritical model of behavior nudge. C. Benefits of resistance training. D. Client-trainer relationship, rapport stage. Question 30. Answer: B. 4 components of transcritical model of behavior nudge. Question 31. Functional contracting unit of the skeletal muscle. Myofibrils found between TZ lines. A. Carcinomas. B. SMART goals. C. Sarcomeres. D. Directors. Question 31. Answer: C. Sarcomeres. Question 32. aka movement training. 5 primary movements. Bend and lift. Single leg. Pushing. Pulling. Rotational. Focus on eccentric muscle actions. A. IFT FM and RT phase 2. B. Rheumatic diseases. C. IFT cord phase 2. D. IFT FM and RT phase 4. Question 32. Answer A. IFT FM and RT phase 2. Question 33. NGT 60 mg/dl. A. Flexibility factors. B. High serum HDL negative risk factor. C. Obesity CVD risk factor. D. Hypertension CVD risk factor. Question 33. Answer B. High serum HDL negative risk factor. Question 34. Program design. Role clarity. Goal setting. Contracts and agreements. A. Stages of CHNOG maintenance. B. Peripheral vascular occlusive disease. C. A personal trainer's role in building exercise adherence. D. Client-trainer relationship, action stage. Question 34. Answer C. A personal trainer's role in building exercise adherence. Question 35. Newton's first law. The property of matter by which it retains its state of rest or its velocity along a straight line so long as it's not acted upon by an external force. A. Inertia. B. Directors. C. Impact. D. Antecedent. Question 35. Answer A. Inertia. Question 36. Fascia that bundles muscle fibers together. A. Epimysin. B. Prices. C. Inertia. D. Baramysin. Question 36. Answer D. Baramysin. Question 37. Has not been exercised 30+ minutes most days of the week. Has been exercising less than 3 months. A. Cigarette smoker CVD risk factor. B. Sedentary lifestyle CVD risk factor. C. Family history CVD risk factor. D. Obesity CVD risk factor. Question 37. Answer B. Sedentary lifestyle CVD risk factor. Question 38. Increase in heart rate and increase in the force of cardiac muscle contraction. A. Encouraging. B. Operant conditioning. C. Principles of training. D. Effects of norepinephrine. Question 38. Answer D. Effects of norepinephrine. Question 39. Voice quality. Eye contact. Facial expressions, hand gestures. Body position. A. Operant conditioning. B. Nonverbal communication components. C. Extrinsic motivation. D. Spinal cord injuries. Question 39. Answer B. Nonverbal communication components. Question 40. Fascia that encased entire muscle. A. Epimysin. B. Expressors. C. Endomysium. D. Impact. Question 40. Answer A. Epimysin. Question 41. Predicts that people will engage in a health behavior based on the perceived threat they feel regarding a health problem and the pros and cons of adopting the behavior. A. Health history form. B. Antecedent. C. Deliberators. D. Health belief model. Question 41. Answer D. Health belief model. Question 42. Sedentary. Does not consider an activity program. A. Effects of norepinephrine. B. Stages of change, pre-contemplation. C. Effects of epinephrine. D. Intrinsic motivation. Question 42. Answer B. Stages of change, pre-contemplation. Question 43, aka non-insulin dependent mellitus. 90 to 95% of all diabetes cases. Insulin resistance. Increased demand for insulin, decreased production from pancreas. insulin resistance and impaired insulin reduction, frequent states of hyperglycemia. 75% of type 2 diabetes victims were obese or are currently obese. A. Prices. B. Type 2 diabetes. C. Impact. D. Hypertonicity. Question 43. Answer B. Type 2 diabetes. Question 44. BMI and GT, 30. Waist girth. Men and GT, 102 cm, 40 in. Women and GT, 88 cm, 35 in. A. Reciprocal inhibition. B. Flexibility factors. C. Obesity CVD risk factor. D. Dyslipidemia CVD risk factor. Question 44. Answer C. Obesity CVD risk factor. Question 45. Specificity. Overload. Progression. A. Principles of training. B. Reflecting. C. Acceleration. D. Stimulus control. Question 45. Answer A. Principles of training. Question 46. A process by which behaviors are influenced by their consequences. Allows us to see behavior change that lead to the engagement of certain behaviors. A. Paraphrasing. B. Questioning. C. Operant conditioning. D. Hypertonicity. Question 46. Answer C. Operant conditioning. Question 47. A goal someone worked hard for usually takes time to build up to. X. Weight loss or lifting a specific weight. A. SMART goals. B. Directors. C. Process goals. D. Product goal. Question 47. Answer D. Product goal. Question 48. Short words or phrases that encourage the client to continue speaking. A. Glucagon. B. Inertia. C. Encouraging. D. Summarizing. Question 48. Answer C. Encouraging. Question 49. LDL and GT, 130 mg/dl. HDL and LT, 40 mg/dl. Total serum cholesterol and GT, 200 mg/dl. On lipid-lowering medication. A. Prediabetes CVD risk factor. B. Cigarette smoker CVD risk factor. C. Family history CVD risk factor. D. Dyslipidemia CVD risk factor. Question 49. Answer D. Dyslipidemia CVD risk factor. Question 50. Give and take communication. Setting goals. Motivational interviewing. Evaluating exercise program. A. Cardiorespiratory training zone 3. B. Client-trainer relationship, planning stage. C. Client-trainer relationship, rapport stage. D. Cardiorespiratory training zone 2. Question 50. Answer B. Client-trainer relationship, planning stage. Question 51. aka stability and mobility training. Low intensity. Improved muscle balance, endurance, core function, flexibility. Assessments, posture, balance, movement, range of motion. A. IFT FM and RT Phase 2. B. IFT Cord Phase 3. C. IFT FM and RT Phase 1. D. IFT Cord Phase 1. Question 51. Answer C. IFT FM and RT Phase 1. Question 52. High sociability, high dominance. More effective, less cognitive, strong communicator, highly motivational. A. Prices. B. Expressors. C. Endumism. D. Directors. Question 52. Answer B. Expressors. Question 53. Using reinforcements to gradually achieve a target behavior. A. Shaping. B. VO2 max. C. Carcinomas. D. SOAP note. Question 53. Answer: A. Shaping. Question 54. Used to determine exercise contraindications and if someone needs a medical release. A. Health history form. B. Reaction forces. C. SMART goals. D. Directors. Question 54. Answer: A. Health history form. Question 55. Develop from epithelial cells and account for 80% of all cancers. A. Insulin. B. Sarcomeres. C. Inertia. D. Carcinomas. Question 55. Answer: D. Carcinomas. Question 56. aka aerobic efficiency training. Increase duration, frequency of sessions. Introduce aerobic intervals. Just above first ventilatory threshold or RPE of 5. A. IFT-FM and RT phase 3. B. IFT-FM and RT phase 1. C. IFT chord phase 2. D. IFT-FM and RT phase 4. Question 56. Answer: C. IFT chord phase 2. Question 57. Designed to assess habitual diet, frequency of food groups eaten over a period of time. Answers can be anything: never, less than once a month, a couple times a day, etc. A. Food frequency questionnaire. B. Extinction. C. Questioning. D. Directors. Question 57. Answer: A. Food frequency questionnaire. Question 58. The act of maintain postural control while moving. A. Antecedent. B. Paraphrasing. C. Dynamic balance. D. Carcinomas. Question 58. Answer: C. Dynamic balance. Question 59. The process to see what level of risk a person might have when exercising. Factors include: known diseases, sign or symptoms, cardiovascular risk factors. A. Impact. B. Ejection fraction. C. Acceleration. D. Risk stratification. Question 59. Answer: D. Risk stratification. Question 60. Result in a complete or incomplete loss of somatic sensory and autonomic functions below the lesion level. Occurs at an early stage in life and 80% are males. A. Operant conditioning. B. Stimulus control. C. Spinal cord injuries. D. Reaction forces. Question 60. Answer: C. Spinal cord injuries. Question 61. The striking of one thing against another, forceful contact. A. Glucagon. B. Inertia. C. Directors. D. Impact. Question 61. Answer: D. Impact. Question 62. Personal, demographic, biomechanical status, activity history, psychological, knowledge, attitudes, and beliefs. Environmental, access to facilities, time and social support. Physical activity, intensity, injury. A. Hypertension CVD risk factor. B. Exercise participation, adherence factors. C. Family history CVD risk factor. D. Sedentary lifestyle CVD risk factor. Question 62. Answer: B. Exercise participation, adherence factors. Question 63. Used by healthcare providers to document patient progress. Subjective, observations, symptoms and client status reports. Objective, vital signs and other test results. Assessment, summary of client's current status. Plans, next steps based on assessments. A. SOAP note. B. Momentum. C. Shaping. D. VO2 max. Question 63. Answer A. SOAP note. Question 64. Realizing the consequences of specific behaviors under certain conditions. A. Extinction. B. Antecedent. C. Directors. D. Punishment. Question 64. Answer B. Antecedent. Question 65, aka assumption of risk. If signed, client is acknowledging the risk of the associated activity. Provides purpose, procedures, risks and benefits associated with the assessments. Limitations. Does not provide legal immunity. Client may also need a verbal review. A. Impact. B. Directors. C. IFT Court Phase 3. D. Informed consent. Question 65. Answer D. Informed consent. Question 66. Any goal that involves your client doing something. X. Walking 2 miles a certain number of times. A. SMART goals. B. Expressors. C. Process goals. D. Directors. Question 66. Answer C. Process goals. Question 67. Fatty deposits of cholesterol and calcium accumulate on the walls of arteries, causing hardening, thickening and lose elasticity. A. Atherosclerosis. B. Antecedent. C. Acceleration. D. Expressors. Question 67. Answer A. Atherosclerosis. Question 68. Decreases glucose oxidation and increases the blood sugar levels. Opposes the actions of insulin. A. Glucagon. B. Prices. C. Shaping. D. Encouraging. Question 68. Answer A. Glucagon. Question 69. Anyone who has smoked in the past 6 months. Exposure to environmental tobacco smoke, 2 and D have smoke. A. Hypertension CVD risk factor. B. Prediabetes CVD risk factor. C. Obesity CVD risk factor. D. Cigarette smoker CVD risk factor. Question 69. Answer D. Cigarette smoker CVD risk factor. Question 70. Newton's second law. A change in velocity. A. Paraphrasing. B. Acceleration. C. Antecedent. D. Extinction. Question 70. Answer B. Acceleration. Question 71. Force or speed of movement. A. VO2 max. B. Epimeson. C. SOAP note. D. Momentum. Question 71. Answer D. Momentum. Question 72. When GTO activation results in an enhanced contraction of the opposing muscle group. A. Reciprocal inhibition. B. Acceleration. C. Extinction. D. Autogenic inhibition. Question 72. Answer D. Autogenic inhibition. Question 73. People who enjoy competition or enjoy exercise because it makes them feel good. A. Inertia. B. Reciprocal inhibition. C. Extinction. D. Intrinsic motivation. Question 73. Answer D. Intrinsic motivation. Question 74. Antecedent can be manipulated in the environment to maximize the likelihood of desirable behaviors. A. Questioning. B. Glucagon. C. Stimulus control. D. Stroke volume. Question 74. Answer C. Stimulus control. Question 75. Rapport, investigation, planning and action stage. A. Stages of client-trainer relationship. B. Stages of change, pre-contemplation. C. Stages of change, action. D. Client-trainer relationship, action stage. Question 75. Answer A. Stages of client-trainer relationship. Question 76. Fasting blood glucose 100 and LT:(X) and GT:(128) on two separate occasions. A. Prediabetes CVD risk factor. B. Hypertension CVD risk factor. C. Flexibility factors. D. Age CVD risk factor. Question 76. Answer A. Prediabetes CVD risk factor. Question 77. Any of various lung disease leading to poor pulmonary aeration, including emphysema and chronic bronchitis. A. Chronic obstructive pulmonary disease. B. Peripheral vascular occlusive disease. C. IFT cord phase 4. D. Peripheral vascular disease. Question 77. Answer A. Chronic obstructive pulmonary disease. Question 78. Between VT1 and VT2 and LT, 10% of training time. A. Cardiorespiratory training zone 2. B. Family history CVD risk factor. C. Risk stratification. D. Cardiorespiratory training zone 3. Question 78. Answer A. Cardiorespiratory training zone 2. Question 79. New intervals to develop peak power and aerobic capacity above the VT2 or PE of 9 or greater. Challenges fast glycolytic system and phosphagon system. A. IFT cord phase 3. B. IFT cord phase 4. C. IFT FM and RT phase 4. D. IFT FM and RT phase 3. Question 79. Answer B. IFT cord phase 4. Question 80. Joint capsule, ligament 47%. Muscle, fascia 41%, tendons 10%. Skin 2%. A. Flexibility factors. B. Ejection fraction. C. Collaborators. D. Directors. Question 80. Answer A. Flexibility factors. Question 81. Some physical activity. Preparing to adopt an activity program. A. Respiratory exchange ratio. B. Stages of nudge maintenance. C. Stages of client-trainer relationship. D. Stages of change preparation. Question 81. Answer D. Stages of change preparation. Question 82. The removal or avoidance of aversive, a feeling of dislike, stimuli following undesirable behavior. A. Reaction forces. B. Positive reinforcement. C. Antecedent. D. Negative reinforcement. Question 82. Answer D. Negative reinforcement. Question 83. Restating in a clear and concise way the essence of what the client has been saying. A. Reflecting. B. Inertia. C. Paraphrasing. D. Carcinomas. Question 83. Answer C. Paraphrasing. Question 84. Protect. Rest, restrict activity. Ice. Compress. Elevate. Support. A. Expressors. B. Epimazin. C. Prices. D. Sarcomers. Question 84. Answer C. Prices. Question 85. aka load training. After postural stability and proper movement, external loading safe. Goals, body composition, muscular strength, hypertrophy, muscular endurance. Reassess stability, mobility and movement patterns if clients spend too long in this phase. A. IFT-FM and RT Phase 2. B. IFT-FM and RT Phase 1. C. IFT Chord Phase 3. D. IFT-FM and RT Phase 3. Question 85. Answer: D. IFT-FM and RT Phase 3. Question 86. Muscle fibers with a complex arrangement that involves the convergence of several tendons. X. Deltoid. A. Soap note. B. Multipnate muscle. C. Collaborators. D. Extinction. Question 86. Answer: B. Multipnate muscle. Question 87. Increase blood glucose levels. Increase the rate and force as amplitude of heartbeats. Dilated blood vessels that seize the heart, lungs and skeletal muscle. A. Reflecting. B. Antecedent. C. Effects of epinephrine. D. Principles of training. Question 87. Answer: C. Effects of epinephrine. Question 88. All foods, beverages and accurate amounts, as possible, consumed within the last 24 hours. A. 24-hour diet recall. B. Process goals. C. Encouraging. D. Sarcomers. Question 88. Answer: A. 24-hour diet recall. Question 89. Muscle fibers run parallel to the long axis of the muscle. Relatively weak compared to other muscles. X. Sartorial. A. Longitudinal muscle. B. Reaction forces. C. Unipinnate muscle. D. Dynamic balance. Question 89. Answer: A. Longitudinal muscle. Question 90. Low sociability, low dominance. Cognitive, less effective, methodical, logical, cautious and may appear rigid. A. Directors. B. Deliberators. C. Expressors. D. Encouraging. Question 90. Answer: B. Deliberators. Question 91. Restates the main points to demonstrate understanding or to seek clarification. A. Shaping. B. Epimazon. C. Paraphrasing. D. Reflecting. Question 91. Answer: D. Reflecting. Question 92. Helpful for getting clients started and are often external rewards. A. Encouraging. B. Extrinsic motivation. C. Reciprocal inhibition. D. Acceleration. Question 92. Answer: B. Extrinsic motivation. Question 93. Muscle fibers insert onto one side of the tendon. X. Anterior tibialis. A. Endomysium. B. Directors. C. Momentum. D. Unipinnate muscle. Question 93. Answer: D. Unipinnate muscle. Question 94. Caused by the development of atherosclerotic plaque that results in the reduction of blood flow to distal regions. A. Deliberators. B. Peripheral artery disease. C. Peripheral activity occlusion disease. D. Unipinnate muscle. Question 94. Answer: B. Peripheral artery disease. Question 95. Leading cause of pain and disability, along with arthritis. 2 types. Osteoarthritis, a degenerative joint disease. Rheumatoid arthritis, chronic systemic inflammatory disease, immune system attacks tissue. A. Rheumatic diseases. B. Reflecting. C. Peripheral artery disease. D. Product goal. Question 95. Answer: A. Rheumatic diseases. Question 96. Myocardial infarction, coronary revascularization or a death related to one of the above of a first-degree relative of CVD, men in LT 55 and female in LT 65 years. A. Prediabetes CVD risk factor. B. Sedentary lifestyle CVD risk factor. C. Obesity CVD risk factor. D. Family history CVD risk factor. Question 96. Answer: D. Family history CVD risk factor. Question 97. Muscle fibers insert obliquely onto each side of the tendon. X. Rectus femoris. A. Soap note. B. Multipennate muscle. C. Pipinnate muscle. D. Longitudinal muscle. Question 97. Answer: C. Pipinnate muscle. Question 98. Rapid drops in blood glucose. Symptoms: shakiness, weakness, abnormal sweating, nervousness, anxiety, tingling of the mouth and fingers, and hunger. A. Glucagon. B. Insulin. C. Endomysium. D. Hypoglycemia. Question 98. Answer: D. Hypoglycemia. Question 99. Minimal pre-exercise screening for low-moderate but not vigorous activity. Limited by lack of details such as conditions, medications and past injuries. If 2 or more health risk, more detailed health risk appraisal is recommended. A. Physical Activity Readiness Questionnaire, PAR-Q. B. Chronic obstructive pulmonary disease. C. Positive reinforcement. D. Food Frequency Questionnaire. Question 99. Answer: A. Physical Activity Readiness Questionnaire, PAR-Q. Question 100. Have been doing regular physical activity for longer than 6 months. A. Stages of CNOG, maintenance. B. Type 1 diabetes. C. Pipinnate muscle. D. Stages of change, contemplation. Question 100. Answer: A. Stages of CNOG, maintenance. Question 101. aka aerobic base. Developing an initial base in clients who have been sedentary or near sedentary. Improvements in health, endurance, energy, mood, caloric expenditure. Monitoring intensity. Talk test: below first ventilatory threshold. RPE, 3-4. Durations as short as 5 minutes. A. Informed consent. B. IFT cord phase 2. C. IFT cord phase 1. D. IFT cord phase 3. Question 101. Answer: C. IFT cord phase 1. Question 102. A positive stimulus that increases the likelihood that the behavior will reoccur in the future. A. Reaction forces. B. Positive reinforcement. C. Negative reinforcement. D. Informed consent. Question 102. Answer: B. Positive reinforcement. Question 103. Muscle spindles stress too quickly, intensely causing the muscle to contract, also known as stretch reflex. A. Reciprocal inhibition. B. Extinction. C. Ejection fraction. D. Insulin. Question 103. Answer: A. Reciprocal inhibition. Question 104. Past performance experience, most influential. Vicarious experience. Verbal persuasion. Physiological state appraisal. Emotional state and mood appraisals. Imaginary experiences. A. Process goals. B. 6 sources of self-efficacy. C. Self-efficacy. D. Effects of epinephrine. Question 104. Answer: B. 6 sources of self-efficacy. Question 105. aka assume. A. Type 1 diabetes. B. Prices. C. Process goals. D. Hypoglycemia. Question 105 Answer, A. Type 1 diabetes. Question 106, Sedentary. Considers activity as important. A. Stages of client-trainer relationship. B. Stages of change, action. C. Stages of change, contemplation. D. Stages of change, pre-contemplation. Question 106 Answer, C. Stages of change, contemplation. Question 107, Newton's third law. Every applied force has an equal and opposite reaction force. A. Deliberators. B. Reaction forces. C. Sarcomers. D. Directors. Question 107 Answer, B. Reaction forces. Question 108, Fascia that traps individual muscle fibers. A. Momentum. B. Endomysium. C. Extinction. D. Paromysium. Question 108 Answer, B. Endomysium. Question 109, Cardiorespiratory fitness. Body composition and anthropometry. Muscular endurance. Muscular strength. Flexibility. A. Peripheral vascular disease. B. Health-related physiological assessments. C. Health history form. D. Negative reinforcement. Question 109 Answer, B. Health-related physiological assessments. Question 110, High sociability, low dominance. More effective, less cognitive, admire, warm, trusting and honest. A. Collaborators. B. Deliberators. C. Directors. D. Carcinomas. Question 110 Answer, A. Collaborators. Question 111, A hormone that facilitates the uptake and utilization of glucose by cells and prevents the breakdown of glycogen. A. Insulin. B. Epimasin. C. Prices. D. Encouraging. Question 111 Answer, A. Insulin. Question 112, aka performance training. Improve speed, agility, quickness, reactivity and power. Performance training techniques, plyometric jump training, medicine ball throws, kettlebell lift, and traditional Olympic-style lifts. Minimize eccentric-concentric transition. Faster transition equals greater amount of force. A. IFT FM and RT phase 2. B. IFT FM and RT phase 4. C. IFT chord phase 2. D. IFT chord phase 4. Question 112 Answer, B. IFT FM and RT phase 4. Question 113, 200 age equals PMHR. Overestimates for young adults and underestimates for older adults. A. Deliberators. B. Piponate muscle. C. Product goal. D. Predicted maximum formula. Question 113 Answer, D. Predicted maximum formula. Question 114, Atherosclerosis of the arteries of the lower extremities. A. Peripheral activity occlusion disease. B. Risk stratification. C. Reciprocal inhibition. D. Spinal cord injuries. Question 114 Answer, A. Peripheral activity occlusion disease.